Hello everyone, this is Dr. Sangeeta Chaudhary once again. I welcome everybody to my channel. Today's class I'm going to discuss about heart failure. Heart failure as such, it is a big topic. So I will subdivide heart failure into three classes. In today's class I will discuss about the definition of heart failure, what is heart failure, different varieties of heart failure, classification of heart failure, and I'll also discuss about the risk factors of heart failure. So let's begin with the definition. So as per the ACCF and AHA, ACCF means American College of Cardiology Foundation. AHA stands for American Heart Association. So these are the standards which we follow for the definition of heart failure. Heart failure, it is a complex clinical syndrome. It results from structural or functional impairment of the ventricular filling or ventricular ejection of blood, which ultimately leads to the cardinal symptoms like dyspnea, that is shortness of breath, fatigue, and signs of heart failure, namely edema and rales. So this is the definition of heart failure. That means it is a clinical syndrome where there is dysfunction in the ventricular filling or maybe in the ventricular ejection of blood, which ultimately results in the symptoms of shortness of breath, that is dyspnea and fatigue, and signs of heart failure, what we clinically see as bilateral beating pedal edema and rales. In the next portion, I will discuss about the epidemiology. 5 million Americans, they have congestive heart failure every year. Blacks have higher risk of heart failure. Prevalence is greater in males than in females in patients aged 40 to 70 years. But after 75 years, there is no sex predilection. So before 70 to 75 years, it is more common in males. But after that, there is no sex predilection. It can happen in a similar prevalence in both males and females. Now, let's talk about the type and etiology. What are the types of heart failure? These days, heart failure are divided into three types. That is heart failure with reduced ejection fraction, when the ejection fraction of left ventricle is less than 40%. Heart failure with preserved ejection fraction, when the ejection fraction is in between 40 to 50%. Borderline ejection fraction heart failure, when the ejection fraction is 40 to 50%. Okay. Now, it is also known as heart failure with moderately reduced ejection fraction. Okay, moderately reduced ejection fraction. So these are the varieties of heart failure. Previously, heart failure was classified into systolic and diastolic heart failure. Now, in the left hand side, there is a normal heart. During diastole, there will be ventricular filling. So these are the ventricles. So there will be ventricular filling during diastole. And what happens during systole? During systole, the ventricle will contract and they will pump the blood out of the ventricle. Left ventricle will pump the blood into the aorta, and right ventricle will pump the blood into the pulmonary trunk, into the pulmonary artery. So what happens in case of systolic heart failure? In case of systolic heart failure, the cardiac chambers, that is ventricles, are usually stretched, they are dilated, and they receive normal amount of blood during the diastole period. So enlarged ventricle, they fills with blood, but during contraction, during systole, they are unable to pump properly, so they cannot inject out the good amount of blood. So they eject less than normal blood. So that is about the systolic failure. What happens in diastolic heart failure? We know during diastole, ventricles get filled up with blood. But in case of diastolic heart failure, the ventricle, they are non-compliant. Okay, because of the non-compliant and stiff ventricle, they receive less amount of blood. Okay, less than normal amount of blood they receive during diastole. So when during systole they try to pump out the blood, they can pump out the whole blood, but because of the ventricular less filling, the cardiac output will be less. Means they have less blood to pump out because of defective diastolic filling. So this is about diastolic heart failure. So from this slide we get to know what is the systolic and what is the diastolic heart failure. Now there is something acute heart failure. Acute heart failure is a medical emergency There'll be sudden development of a large myocardial infarction or maybe due to rupture of the myocardium or a cardiac valve in a patient who previously was entirely well. Usually, predominant systolic dysfunction will be there in case of acute heart failure. So, acute heart failure is usually due to a large myocardial infarction or maybe due to a rupture of a cardiac valve, when the patient presents very dramatically. Now, coming to the causes of heart failure. So, what are the causes of heart failure? As I said, heart failure can be divided into three varieties: depressed ejection fraction, preserved ejection fraction, okay, and borderline ejection fraction. So, depressed ejection fraction or heart failure with reduced ejection fraction. When the ejection fraction is less than 40, the causes may be coronary artery disease, myocardial ischemia or infarction, chronic pressure overload, hypertension and obstructive valvular disease, chronic volume overload condition like regurgitant lesion in the heart, shunting, intracardiac shunting like ASD, VSD, extracardiac shunting, chronic lung disease, and non-ischemic DCM, that is dilated cardiomyopathy, toxic induced and drug induced, metabolic disorders, viral diseases, Chagas disease, disorders of rate and rhythm, that is bradyarrhythmia, tachyarrhythmia. All these things can cause heart failure with reduced ejection fraction. Now, heart failure with maintained or preserved ejection fraction, that is when the ejection fraction is more than 40 to 50%. Pathologic hypertrophy, primary hypertrophic cardiomyopathy, secondary hypertrophy as a result of hypertension, aging, endomyocardial disorders, restrictive cardiomyopathy, for example, infiltrative disorders like amyloidosis, sarcoidosis, storage disease, and cardiac fibrosis. These are the causes of heart failure with preserved ejection fraction. High output heart failure is known as when there is hyperdynamic circulation, high output state, means high cardiac output states. Metabolic disorders like thyrotoxicosis, nutritional problem like beriberi due to thiamine deficiency, and excessive blood flow requirements, systemic arteriovenous shunting, and chronic anemia. So these are the conditions where there will be high output heart failure or high output states. Now, as I was saying, there is certain classification of heart failure which we predominantly follow is NYHA classification, that is New York Heart Association classification. They classify heart failure into 4 categories depending on the functional capacity of the patient. Class 1. In class 1, patients, they have cardiac disease but there is no limitation of any physical activity. Okay, without resulting limitation of physical activity, patient can perform ordinary physical activity without any undue fatigue, palpitation, dyspnea or anginal chest pain. Class 2, patients with cardiac disease and there is slight limitation of physical activity. They are comfortable at rest but ordinary physical activity results in palpitation, fatigue, dyspnea, anginal pain. Class 3, patient with cardiac disease and there is marked limitation of physical activity. They are comfortable at rest. Less than ordinary physical activity also causes fatigue, palpitation, dyspnea and anginal pain. Class 4, patients with cardiac disease resulting in inability to carry on any physical activity without discomfort. They will be uncomfortable even at rest. Okay, symptoms of heart failure or the anginal syndrome may be present even at rest. If any physical activity is undertaken, discomfort is increased. So this is about the NYHA classification of heart failure. This is very important when you perform examination of a patient. Okay, bedside clinics also, it is very important to classify the stage of heart failure the patient is in, and it is very important from the treatment or management point of view also. So class 1, class 2, class 3, class 4. Class 1, there is no limitation of physical activity. Class 2, there is slight limitation of physical activity. Okay. And class 3, there is marked limitation. Okay. That means there is so much limitation of physical activity. And class 4, even at rest also, patient has all the symptoms of angina and anginal equivalents. Now, ACC and AHS staging of heart failure. ACC stands for American College of Cardiology. AHS stands for American Heart Association. So, stage A, they are at high risk for heart failure, but there is no structural heart disease or symptoms of heart failure. Means stage A is only for the patients who are at risk of heart failure. Stage B, there is structural heart disease present, but without any sign or symptoms of heart failure. Stage C, structural heart disease with prior or current symptoms of heart failure. And stage D, there is refractory heart failure. Means heart failure is not improving even with the conventional treatment. Refractory heart failure requiring specialized intervention. So stage A, B, C and D. A, people who are at high risk. B, there is heart disease but there is no sign and symptoms of heart failure. Stage C, there is heart disease and there is symptoms of heart failure, prior or present symptoms. Stage D, that is the worst, that means there is refractory heart failure requiring specialized intervention. Risk factors. Who are at risk of development of heart failure? Okay, there are so many risk factors. Modifiable, non-modifiable. Hypertension is one of the very important risk factor. Coronary artery disease patient, they develop heart failure. Advancing age, diabetes mellitus, obesity, high serum cholesterol, valvular heart disease and hypervolemia, there is high output states. So all these are the patients who are at high risk of development of heart failure. So whenever we see a patient with these conditions, we need to remember that they are at high risk of development of heart failure. So we need to take care of these patients very well. Lastly, precipitating factors of heart failure. So what are the precipitating factors? Means there are conditions which can precipitate or which can ultimately lead to heart failure. Rapid arrhythmia, events which leads to rapid deterioration. So rapid arrhythmia, a severe bradycardia, conduction disturbance, acute coronary syndrome, they usually causes acute heart failure. Mechanical complication of acute coronary syndrome, that may be rupture of IVS, that is intraventricular septum, mitral valve chordal rupture, right ventricular infarction, acute pulmonary embolism, hypertensive crisis, cardiac tamponade, aortic dissection, surgery and perioperative problems and peripartum cardiomyopathy. These are the causes of acute cardiac failure, that is rapid worsening of cardiac failure. And events which usually leads to less rapid deterioration, maybe chronic heart failure, they will lead to, like for example, infection, including infective endocarditis, exacerbation of COPD or asthma, anemia, kidney dysfunction, non-adherence to diet and drug therapy of course, and iatrogenic causes due to certain drugs also, then arrhythmias, bradycardia, conduction disturbances not leading to sudden severe change in heart rate. Okay, so these are the causes of precipitating factors of heart failure which causes a less rapid deterioration of cardiac function. So this is all about the class which I wanted to discuss. In next class, I'll discuss about the pathophysiology and all those differential diagnosis and all. Thank you so much for attending.